Why are we still doing this? Hormone replacement therapy is given to 40% of U.S. women, and it does not work. So the question's been asked, why do we continue prescribing? Next thing is, people get headaches. Women get lots of headaches. So what do we recommend? Well, obviously, hospital-safe Tylenol. The problem is that 38% of liver transplants are not done because of alcohol abuse and because of drug abuse. They are done because of acetaminophen. They are done because of Tylenol. What do we do for our other illnesses? Well, we take drugs, and we live in South Florida, and we need to be aware that 70% of doctors who treat Medicare patients flunked an exam of which medications go with which medications. And as a result, elderly patients have a real problem. So we need to be aware of that, living here in South Florida especially. And then what happens is we spend $75 billion a year on drugs, and we spend $76 billion a year on treating the side effects of drugs. It really is time to stop the madness. Drugs are the fourth leading cause of death in America today. Heart attack, cancer, heart disease, stroke, death due to adverse drug reactions. So what do we need to do? Prevention, folks. The Surgeon General in 1988 talked about the diseases of dietary excess now accounts for the billions of healthcare dollars that are spent. They talked about that physicians need to be better educated about nutrition, and that physicians need to better educate their patients about nutrition. They talked about in 1988, 23 years ago, that dietary excess diseases are accounting for all this money that we're spending that's going to bankrupt our country. And you've seen me before, and I've asked this question before. You know, when was the last time you went to your doctor and they asked you, what do you eat? Very few people get an interaction with your doctor. And we need to determine, what are we doing? Do we practice health care or do we practice sick care? America practices sick care. Let me give you the definition. Sick care says that when I get sick, I can go to my doctor, and my doctor will treat me, and he can send it to my insurance, and my insurance will pay for that. I have to have a diagnosis. I have to have something wrong with me before my insurance will pay. Healthcare says, I'm not going to wait until I get sick. I'm going to do something right here, right now. I'm going to pay for it out of my own pocket. I'm going to prevent illness, and I'll be so much better than having to wait until I get sick. It's tantamount to an 18-wheeler coming down the road. I see it coming, and I know that it's going to hit me. The way sick care works and the way we do it in this country is we say, oh, wait until it hits you, and then we'll pick up the pieces, and your insurance will cover it. The way healthcare says is, you know what, I don't want to get hit at all. I'm going to move out of the way right now and do something. That's the difference between sick care and healthcare. Sick care doesn't work. Statistically, it's borne out. It's bankrupting our nation. America practices sick care. We consume most drugs. We wait until we're sick, until we go to the doctor. We're not proactive, and as a result, we're one of the least healthy nations in the world. As a matter of fact, we rank 37th on the list. There are countries, has anybody heard of this country? Oman, third one from the bottom, Oman. I've never even heard of that country, honestly. But it's healthier than we are. Costa Rica, Cuba. Cuba is healthier than we are. We need to change what we're doing. America spends nearly $64,000 every single second on sick care. That equates to go out and buy a brand new Porsche Cayman every second. We need wellness. Our officials are finally starting to get on board because we've got a $1 trillion debt and health is going by the wayside. But it's going to take time. Probably not in our lifetime are we going to make those appropriate changes. So it's up to us, or it's up to we as individuals, to do the right thing for ourselves. So we have a healthcare model that is now arisen. It's called a wellness model. And they talked about that people are dissatisfied with healthcare. They talked about that people are looking to embrace alternative measures. They're talking about people starting to take responsibility for their health. As a matter of fact, alternative therapies are really taking over. People are going to alternative providers today more than traditional medicine. We have a great store like Tooney's here where all of us shop, and there's a reason for that, because they have great products and they help us to get well, and they end up saving us money. So alternative therapies continue to grow. As a matter of fact, people are willing to spend upwards of $5,000 above and beyond their insurance policy to make sure that they stay healthy. They're willing to go to an alternative provider and pay for nutritional help, to pay to stop smoking, to pay for safe and natural pain control, instead of taking drugs. But we have challenges. First challenge is not knowing what the perfect diet is for your individual body. We talked before, do you think that you eat well? And almost everybody raised their hand. Well, the research shows that we think we do, but we really don't. And we showed you before that even if you think you're eating well and are eating well, the nutritional content is not really there in our food supply. The other thing is we deal with one size fits all. The food pyramid group is a good example of one size fits all, which has now been changed. But one size fits all doesn't work. The researchers have borne that out also. And how do we do nutrition in this country? We pop and we pray. My friend took CoQ10, I'll take CoQ10. My doctor told me to take calcium, I'll take calcium. Or we do it based on a symptom questionnaire. We fill out a symptom questionnaire, we take what it says. Or we read the latest, greatest book. All ways of doing it, and I applaud, our efforts. But our efforts need to get customized. Testing procedures are the least commonly used way of deciding. And in my opinion, it should be first. Challenge number 2, taking into account that you can digest all those great supplements that you take. Well, not true. This is an x-ray of a patient, 48 years old. She came to me with lower back pain. I did a history on her, and in her history, she told me that her mom has osteoporosis. Her mom is in her 80s. And I asked this 48-year-old female, what are you doing to prevent osteoporosis? And she said, I'm taking calcium, 1,000 milligrams a day, with vitamin D, I'm doing weight-bearing exercises, and I'm getting magnesium also. I said, who recommended that? She said, my gynecologist. I said, how did he come upon giving you that? And she said, oh, he did a bone density study and told me to take it. So she thinks that she's preventing osteoporosis. This is her spine. These are her ribs. And right here is her intestine, and right there, what is that? It is 1,000 milligrams of undigested calcium. Remember what I told you before. What is the magic bus that drives protein into the body? Protein. What happens is females never get enough protein. We talked about that. We also talked about that after you pass the age of 40, what happens? You don't digest your protein very well. She's 48. So nobody took into account, is she able to digest and utilize that calcium? Nobody took into account what does her protein levels look like. So the sin of this whole thing is she thinks she's preventing osteoporosis. And in 27 years, she'll be diagnosed with it also, just like her mom. And everybody will scratch their heads saying, how did that happen? She took calcium, she took vitamin D, she did weight-bearing exercises, because you need to take into account the whole picture of digestion. You need to know specifically what's going to work for you. Not using scientific methods to determine what supplements you should be taking in what diet is another major challenge. The American Dietetic Association talks about they don't even know what to recommend for people because people are different. Think about it. I have a 40-year-old woman who goes and wants to take some supplements, and she has her period, and she just buried her dog, and she just had a fight with her kids, and she's just about to lose her job. And now I have a 40-year-old woman who doesn't have her period, who has a great day, just got a promotion. Don't you think their nutritional requirements are different? So the American Dietetic Association says, eat this, take that, but it's not uniform. It's not uniform. Everybody is an individual. So they even admit that they have problems. WebMD talks about, don't just take a handful of supplements. Know what you're taking. They do interact. And my favorite is, I'll have a patient that's taking, let's say, vitamin C, tons of vitamin C. And I'll say, why are you taking all this vitamin C? Oh, never got a cold, doc. I say, well, what happens if you take too much of it? Oh, that's not a problem. Well, why? It's water soluble. Well, what does that mean? You pee it out. Well, how do you pee it out? I don't know. Well, your kidneys have to process and concentrate that. Your kidneys have to overwork. What happens to anything that overworks? It breaks down. So there are some strategies. The first strategy is functional digestive nutritional testing. You really need to go to your doctor and ask him to perform or her to perform functional digestive nutritional testing tests. What are they and what do they do? They should be test procedures that are reliable, reproducible, and measurable. What I do in my office is we utilize a functional test where we examine a patient fasting. Why fasting? Because they're a different person when they fast than if they just ate a hamburger. And we examine them physically, head to toe, looking at every single organ system. So for example, we palpate right here. Palpate means to feel. And this is the biliary system, the gallbladder and liver. And we palpate this area, and on the fast, everything is fine. We then feed you a nutrient-rich drink, the proper ratio of proteins, fibers, fats, and carbohydrates, all the constituents of food that a normal, healthy adult should be able to digest in 45 minutes. We then have the patient digest for 45 minutes, come back in, and we redo the same exact exam. And we compare fasting to after eating. So in this example, on the fast, no problem with the biliary system. After they eat and digest, whoa, doc, what's that? Muscle contracture indicating that you did not digest something, that gallbladder and liver wasn't working. We then couple that with biochemical testing of 24-hour urine samples, blood work if necessary, and we come up with a proper diagnosis as to what's going on, where's the imbalance, and then we give you the appropriate diet for your body. Now, I'm not asking you to eat wheatgrass and sprouts if you don't want to eat wheatgrass and sprouts. What I am going to do is find out what offending foods are there and either minimize them or recommend you come off of them. And we're going to give you the right supplements, okay, to support the organs. The supplements can be bought right here at Tooney's, and it's going to be scientifically done so you know specifically what you should be eating and specifically what supplements you should be taking. We also utilize a very, very great piece of data called the bioimpedance analysis. NASA uses a BIA. All the pharmaceutical companies use BIAs. Yale uses BIAs. Harvard uses BIAs. What a BIA is a painless bioelectrical test where we hook up electrodes throughout the body, and it's like taking an EKG for your whole body. And we're able to look at all the different compartments of the body. So for example, one of the things that we're able to look at is the intra and extracellular fluid. The intra and extracellular fluid should be in a 60 to 40% relationship. If that relationship is off, what that means is that you're either not going to get enough nutrients to the cell, or you're accumulating too much waste and you're killing your cells. This little tidbit of information is really, really powerful, because then we know what nutrients to give you to write that. And you can be taking all the great nutrients in the world, but if that relationship is off, they're not going to get into the cell. The second thing that we get is a health and activity evaluation, an enzyme activity chart. And this is really, really important. It's called a phase angle. And a phase angle is a measurement of your health, of your vitality. If I was to take a phase angle of this piece of wood, the phase angle would be 0 because it's dead. The optimal place is to be at 10. The minimum is at, well, average starts at 6. We never want to see you below 6. And we definitely don't want to see you in the 4. So by taking this test, we're able to know how vital is this body, how healthy is this body. It's a phenomenal, phenomenal